Kevin Keegan is one of the most recognizable names in English football, a former England captain, a Liverpool hero, a Newcastle United legend, a manager who gave fans some of the most exciting football memories of their lives. But recently, Kevin Keegan revealed something far more personal than anything that happened on a football pitch. He revealed that he has stage 4 cancer. Some reports have described this as stage 4 stomach cancer. And according to reports, his cancer was discovered after investigations following abdominal symptoms and scans. Now, this video is not about speculating on Kevin Keegan's private medical details. We do not know every part of his diagnosis. We do not know his exact treatment plan, and we should respect his privacy and his family. But his story does raise something very important, because stomach cancer can be one of those cancers that begins quietly. It can start with symptoms that many people dismiss as indigestion, reflux, stress, a stomach bug, aging, or just something I ate. And by the time it is found, in some people, it may already have spread. That is why this video matters. Because if one person watching this recognizes a symptom early, if one person books that GP appointment, if one person pushes for help when something does not feel right, then this video could genuinely make a difference. So in this video, I'm going to explain, in simple terms, what stomach cancer is, why it can be missed, the warning signs you should not ignore, the risk factors that increase the chance of developing it, how doctors investigate it, and what treatment options may be considered, including surgery, chemotherapy, targeted therapy, immunotherapy, and palliative care. And please stay with me until the end, because I'll also give you a simple checklist of when you should seek medical advice. Now let's start with the key question. What exactly is stomach cancer? Stomach cancer, also called gastric cancer, happens when abnormal cells in the lining or wall of the stomach begin to grow in an uncontrolled way. The stomach is part of the digestive system. It sits between the food pipe, which is called the esophagus, and the first part of the small bowel. Its job is to store food, mix it with acid and digestive juices, and help break it down before it passes into the intestines. Most stomach cancers start in the inner lining of the stomach. The most common type is called adenocarcinoma. But for most people watching this video, the exact medical name is less important than understanding the pattern. The danger with stomach cancer is that early symptoms can be vague. They can feel like ordinary stomach problems. And that is why people often wait. They wait because they think it is indigestion. They wait because they think it is reflux. They wait because they do not want to bother the doctor. But here is the important point. You are not wasting anyone's time by getting persistent or unusual symptoms checked. You are doing exactly the right thing, because when cancer is found earlier, treatment options are often better. Now, stage 4 cancer means the cancer has spread from where it started to another part of the body. For stomach cancer, that could mean spread to the liver, the lining of the abdomen, distant lymph nodes, the lungs, or other areas. Stage 4 does not mean every person is the same. It does not tell us exactly how someone feels. It does not tell us exactly how they will respond to treatment. But it does usually mean the cancer is advanced, and treatment is often aimed at controlling the cancer, improving symptoms, slowing progression, and helping the person live as well and as long as possible. That is why early recognition is so important. So let's go through the warning signs. The first symptom is indigestion that does not go away. Now, indigestion is extremely common. Most people with indigestion do not have cancer. You may feel burning, discomfort, bloating, burping, nausea, or a heavy sensation after eating. Often it is caused by reflux, gastritis, ulcers, spicy foods, stress, or eating late at night. But the warning sign is when it is new, persistent, worsening, or different from your usual pattern. Do not just keep buying antacids for months. Do not simply change your diet again and again without speaking to a doctor. Persistent indigestion can still be harmless, but it deserves proper assessment. The second symptom is feeling full very quickly. This is one of the signs people often overlook. You sit down to eat a normal meal, but after just a few mouthfuls, you feel full. You may say, I just don't have the appetite I used to, or I can only manage half my plate, or food feels heavy in my stomach. This can happen for many reasons, but if it is new and persistent, it matters. A tumor in or near the stomach can affect how the stomach stretches, empties, or handles food. It can make eating uncomfortable. It can make people eat less without meaning to. And over time, that can lead to weight loss, weakness, and malnutrition. The third warning sign is unexplained weight loss. This is one of the most important red flags in medicine. If you are losing weight without trying, always take it seriously, especially if you are not dieting, especially if your appetite has dropped, especially if your clothes are becoming loose, especially if family members notice before you do. Weight loss does not automatically mean cancer. It can be caused by thyroid disease, diabetes, depression, medication side effects, and many other conditions. But unexplained weight loss should not be ignored. When doctors hear the combination of weight loss plus upper abdominal symptoms, reflux, indigestion, swallowing difficulty, or reduced appetite, that is a pattern that needs proper investigation. The fourth symptom is pain or discomfort in the upper abdomen. This is usually felt in the upper part of the tummy, around the area just below the breastbone. Some people describe it as a dull ache. Some describe pressure. Some describe burning. Some describe a deep discomfort after eating. Again, many common conditions can cause this, but the pattern is what matters. Pain that is persistent, pain that is getting worse, pain that wakes you at night, pain associated with weight loss, pain with vomiting, pain with black stools, pain with tiredness and anemia. Those combinations should never be brushed aside. The fifth symptom is nausea or vomiting. Feeling sick can happen with infections, migraines, medication, gallbladder problems, alcohol, reflux, and many other things. But repeated vomiting, especially if it persists, needs assessment. In stomach cancer, vomiting may happen if the cancer affects the way food passes through the stomach. Sometimes people vomit undigested food. Sometimes they feel bloated and full for hours. Sometimes they cannot tolerate normal meals. And if vomiting is severe, persistent, or associated with dehydration, weight loss, blood, or severe pain, that needs urgent medical advice. The sixth warning sign is difficulty swallowing. Now, swallowing difficulty can be a symptom of esophageal cancer, which is cancer of the food pipe, but it can also be relevant to cancers around the junction between the esophagus and stomach. The important thing is this: if food feels like it is getting stuck, if swallowing is painful, if you are avoiding certain foods because they do not go down properly, if you need more water to push food down, or if swallowing difficulty is progressively getting worse, do not ignore it. Difficulty swallowing is not a symptom to watch for months. It should be assessed. The seventh warning sign is black stools or signs of bleeding. This is a very important one. If there is bleeding from the stomach, blood can be digested as it passes through the bowel. This can make the stool look black, sticky, tar-like, or unusually dark. This is called melena. It may have a very strong smell. Some people may not see obvious red blood. Instead, they may become anemic over time. They may feel tired, dizzy, breathless on exertion, weak, or notice palpitations. Anemia can sometimes be the clue that the body is losing blood slowly from the digestive tract. So if you have black stools, vomiting blood, or symptoms of anemia, seek medical help urgently. And if you are on iron tablets, remember they can also darken stools. But do not assume that is the cause without speaking to a doctor, especially if the change is new or you feel unwell. The eighth symptom is tiredness and low energy. This is difficult because tiredness is one of the commonest symptoms in the world. Most tiredness is not cancer. People are tired because of poor sleep, stress, long work hours, thyroid problems, and many other reasons. But tiredness becomes more concerning when it is persistent, unexplained, and associated with other symptoms. Tiredness plus weight loss, tiredness plus reduced appetite, tiredness plus black stools, tiredness plus breathlessness, tiredness plus persistent indigestion. That is different from being tired after a busy week. That is your body telling you something may be wrong. The ninth symptom is a lump or swelling in the upper abdomen. Some people may notice a fullness, swelling, or lump in the upper tummy. Some people may notice a fullness. This is less common as an early symptom, but if you feel a new lump or persistent swelling, it should be examined. Do not keep pressing it every day and worrying in silence. Book an appointment. Now, before we go further, I want to be very clear. These symptoms are common. Most people with indigestion, reflux, bloating, nausea, or tummy discomfort do not have stomach cancer. But the point is not to panic. The point is to recognize when symptoms are persistent, new, worsening, unexplained, or happening together. Cancer symptoms are often not one dramatic sign. They are often a pattern, and that pattern might be new indigestion that does not settle, feeling full after small meals, loss of appetite, weight loss, upper abdominal pain, nausea or vomiting, difficulty swallowing, black stools, anemia, unusual tiredness. That combination should never be ignored. Now let's talk about risk factors. A risk factor does not mean you will definitely get stomach cancer. And having no risk factors does not mean you are completely safe. But risk factors help us understand who may be more vulnerable. The first risk factor is age. Stomach cancer becomes more common as people get older. It can happen in younger adults, but it is more common later in life. That is why new digestive symptoms in an older person deserve particular attention. A 25-year-old with occasional heartburn after a heavy meal is very different from a 70-year-old with new indigestion, weight loss, and early fullness. The second risk factor is being male. Stomach cancer is generally more common in men than women. Again, that does not mean women cannot get it. They absolutely can. But men, especially older men, should not dismiss persistent digestive symptoms. The third risk factor is Helicobacter pylori infection. This is often called H. pylori. It is a type of bacteria that can live in the stomach lining. Many people with H. pylori never develop cancer, but long-term H. pylori infection can increase the risk of stomach inflammation, ulcers, and in some people, stomach cancer. The good news is that H. pylori can often be tested for and treated with a combination of antibiotics and acid-reducing medication. So if you have persistent indigestion, a history of ulcers, or repeated stomach symptoms, your doctor may consider H. pylori testing. The fourth risk factor is long-term inflammation or certain stomach conditions. Long-term gastritis, severe acid reflux, pernicious anemia, or changes in the stomach lining can increase risk. Pernicious anemia is a condition where the body struggles to absorb vitamin B12 because of an autoimmune process affecting the stomach. People with known stomach conditions should not panic, but they should keep up with medical follow-up and report any change in symptoms. The fifth risk factor is family history. If a close relative, such as a parent, brother, or sister, has had stomach cancer, your own risk may be higher. This does not mean you will get it, but it means you should be more alert to persistent symptoms and make sure your doctor knows your family history. In rare families, inherited genetic conditions can increase the risk of stomach cancer, and specialist genetic advice may be considered. The sixth risk factor is smoking. Smoking increases the risk of many cancers, including cancers of the digestive system. If you smoke, stopping is one of the most powerful things you can do for your long-term health. It reduces risk not only for stomach cancer, but also lung cancer, heart attacks, strokes, peripheral vascular disease, and chronic lung disease. The seventh risk factor is diet. A diet high in salt, heavily salted foods, smoked foods, and processed meats may increase risk. A diet low in fruit and vegetables may also contribute. This does not mean one salty meal causes cancer. It does not mean you can never eat your favorite foods. But over years, patterns matter. A healthier pattern is to reduce salt, eat more fruit and vegetables, include fiber-rich foods, avoid smoking, limit alcohol, and maintain a healthy weight. The eighth risk factor is alcohol. The relationship between alcohol and stomach cancer is complex, but heavy alcohol intake is harmful for many reasons. It increases the risk of several cancers, liver disease, high blood pressure, accidents, depression, and heart problems. So reducing alcohol is a sensible prevention step. The ninth risk factor is being overweight or obese. Excess weight is linked with several cancers and can also worsen reflux and other digestive symptoms. Again, this is not about blame. Cancer is never a moral failure. This is about risk reduction. Even modest sustainable changes in weight, movement, food choices, smoking, and alcohol can improve health. The 10th risk factor is occupational exposure. Some jobs involving exposure to certain dusts or chemicals may increase risk. This is why protective equipment matters. Now let's move to diagnosis. What should happen if someone has concerning symptoms? The first step is usually seeing a GP. Your GP may ask, how long have the symptoms been happening? Are they getting worse? Have you lost weight? Are you eating less? Any vomiting? Any swallowing difficulty? Any black stools? Any blood? Any family history? Any smoking or alcohol history? Any medications such as aspirin, anti-inflammatories, steroids, or blood thinners? They may examine your abdomen. They may check your weight. They may arrange blood tests. Blood tests might include a full blood count to look for anemia, liver function tests, inflammatory markers, kidney function, and sometimes B12 or iron studies depending on the story. They may check for H. pylori. They may test stool in some cases. But the key investigation for suspected stomach cancer is usually an endoscopy. This is also called gastroscopy. An endoscopy is a camera test. A thin, flexible tube with a camera is passed through the mouth, down the throat, into the stomach. It allows the specialist to directly look at the lining of the esophagus, stomach, and first part of the small bowel. If they see an abnormal area, they can take a biopsy. A biopsy means a small sample of tissue. That sample is then examined under a microscope to see whether cancer cells are present. This is important because scans can suggest cancer, but tissue diagnosis often confirms what it is. Many people fear endoscopy. They imagine it will be unbearable, but the test is usually short. Patients may be offered throat spray or sedation. It can be uncomfortable, but it is one of the most important tests for diagnosing upper digestive cancers. If cancer is found, the next step is staging. Staging means finding out how far the cancer has spread. This may involve CT scans, PET scans in selected cases, endoscopic ultrasound, laparoscopy, and other tests depending on the situation. Doctors need this information because treatment depends heavily on stage. An early cancer that is small and has not spread may be treated very differently from an advanced cancer that has spread to other organs. The specialist team will also look at the patient's overall health. Can they tolerate major surgery? Can they tolerate chemotherapy? What are their kidney function, heart function, nutrition, weight and fitness like? What matters to the patient? What are their goals? This is where the multidisciplinary team comes in. That team may include surgeons, oncologists, radiologists, pathologists, gastroenterologists, specialist nurses, dietitians, palliative care doctors, and other professionals. Cancer care is rarely one doctor making a decision alone. It is a team approach. Now let's talk about treatment. Treatment depends on the type of stomach cancer, where it is, how large it is, whether it has spread, and the patient's general health. For early stomach cancer, surgery may be considered. Surgery may involve removing part of the stomach, or sometimes all of the stomach. This is major surgery. It can be life-changing. After stomach surgery, people may need to eat smaller meals, adapt their diet, take supplements, and have long-term follow-up. But if cancer is found early and can be removed completely, surgery can be an important part of treatment. Sometimes chemotherapy is given before surgery to shrink the cancer. Sometimes chemotherapy is given after surgery to reduce the risk of recurrence. Sometimes chemotherapy is given both before and after surgery. The exact plan depends on the cancer and the patient. For more advanced cancer, chemotherapy may be used to slow growth, shrink tumors, relieve symptoms, and help people live longer. Chemotherapy is not one single drug. There are different combinations. The oncology team will consider what is most suitable. Side effects may include tiredness, nausea, infection risk, mouth ulcers, diarrhea, numbness or tingling, hair changes, appetite problems, and low blood counts. But treatments and supportive medications have improved over time. Many people tolerate treatment better than they expect, although it can still be physically and emotionally demanding. Radiotherapy may also be used in some cases. Radiotherapy uses targeted radiation to kill cancer cells. In stomach cancer, it may be used with chemotherapy in selected settings or to help control symptoms in advanced disease, such as pain or bleeding. Immunotherapy may also be used for some people. Immunotherapy helps the immune system recognize and attack cancer cells. But we also have to be honest. In stage 4 stomach cancer, cure is often not possible. That is a devastating sentence to hear. But not curable does not mean nothing can be done. There is almost always something that can be done. Treatment may slow the cancer. Treatment may relieve symptoms. Treatment may improve eating. Treatment may reduce bleeding. Treatment may reduce pain. Treatment may help someone spend more meaningful time with family. And palliative care is a crucial part of this. Many people hear the phrase palliative care and think it means giving up. It does not. Palliative care is about symptom control, quality of life, emotional support, planning, dignity, and helping people live as well as possible. Palliative care can be involved alongside active cancer treatment. It can help with pain, nausea, appetite, breathlessness, fatigue, anxiety, constipation, nutrition, and family support. Good palliative care is not the absence of treatment. It is an essential form of treatment. Now let's return to Kevin Keegan. When someone like Kevin Keegan speaks publicly about stage 4 cancer, it affects people. Fans remember the goals. They remember the passion. They remember the energy. They remember the man who inspired a generation. And then suddenly, the story becomes human. Because cancer does not care how famous you are. It does not care how fit you once were. It does not care how strong your reputation is. It can affect anyone. But awareness can change outcomes. Not always, not for everyone, but often enough that it matters. So what should you do after watching this video? Here is the checklist I want you to remember. See a doctor if you have indigestion, reflux, or upper abdominal discomfort that is new, persistent, worsening, or not improving after a few weeks. See a doctor if you are losing weight without trying. See a doctor if you feel full after only small amounts of food, and this is new for you. See a doctor if you have difficulty swallowing. See a doctor if you have repeated vomiting. See a doctor if you have persistent upper abdominal pain. Seek urgent medical advice if you vomit blood, pass black tarry stools, feel faint, become very weak, or have severe abdominal pain. And if you are over 55 and develop weight loss with indigestion, reflux, or upper abdominal pain, Do not delay. Please get assessed. Now, many people watching this will be thinking, but I don't want to waste the doctor's time. You are not wasting anyone's time. Doctors would much rather see you early and reassure you than see you late when things have progressed. Another person may be thinking, I've had reflux for years. How do I know when to worry? The answer is change. If your usual symptoms change, if they become more frequent, if they become more severe, if they stop responding to your normal treatment, if they come with weight loss, swallowing problems, vomiting, bleeding, or anemia, get checked. Another person may be thinking, what can I do to reduce my risk? You cannot remove risk completely, but you can reduce it. Do not smoke, reduce alcohol, keep salt intake sensible, eat more fruit and vegetables, maintain a healthy weight. Do not ignore persistent symptoms. Know your family history and attend appointments and investigations when referred. And perhaps the biggest message is this. Do not normalize symptoms just because they are common. Indigestion is common, bloating is common, tiredness is common, reduced appetite is common. But when common symptoms become persistent, unusual, progressive, or combined with weight loss or bleeding, they deserve attention. That is the difference. Not panic. Pattern recognition. Not fear. Action. So Keegan's story is a reminder that even people who seem larger than life can face frightening diagnoses. A reminder that abdominal symptoms should not always be brushed off. A reminder that stage 4 cancer often means the disease has already spread. And a reminder that earlier diagnosis can make a real difference. If you take one thing from this video, let it be this. If your stomach symptoms are new, persistent, worsening, or not normal for you, please do not ignore them. Book the appointment, ask the question, get checked, because sometimes the symptom you almost dismiss is the symptom that needed attention. And if this video helps even one person recognize those signs earlier, then sharing Keegan's story with care and respect will have done something important. If you found this helpful, please consider subscribing and share it with someone who always says it's probably just indigestion, because sometimes it is, but sometimes it is not. Take care of yourself, and I'll see you in the next video.